So how guys, how are you? We are continuing with the Kulsung Intensive Care Sciences, and today in the surgery general surgery we will discuss the gastroesophageal reflux disease and the complications of the surgical procedure of the gastrointestinal tract and the diseases, infections, the problems associated with it. So upper GI bleeding, C3, P1, ulcer. So let's discuss what the ulcers are. Ulcers. Ulcer involve painful open sores in the stomach, gastric or upper small intestine. Small duodenal lining typically cause H. pylori infection or long-term nasal pain relief. Common symptoms include a burning, gurgling, abdominal pain, often relieved by food or anti-acids. Diagnosis is usually through endoscopy or test for H. pylori, and treatment involves antibiotics and acid-reducing medicine and lifestyle changes. Key aspect of pulmonary ulcer: burning, stomach pain, nausea, vomiting, feeling full, heartburn, bloating, and in some cases stary stools or vomiting. Blood main causes irregular bacterial infection. Regular and long-term use of non-steroidal anti-inflammatory drugs such as aspirin, ibuprofen, or naproxen. Risk factors include smoking, high alcohol consumption, stress, and rarely zonal elation. Symptom diagnosis include endoscopy, H. pylori test, and barium swallow. Treatment includes antibiotics, proton pump inhibitors, and H2 blockers. Lifestyle changes. The types of ulcers include skin pressure ulcer, diabetic foot ulcer, mouth ulcer. What are the main causes of ulcer include pylori infection and non-steroidal anti-inflammatory drugs. Other causes of pulmonary ulcer are uncommon or rare. People with certain risk factors are more likely to develop ulcer. What food should you avoid with ulcer? Alcohol, carbonated beverages, caffeine, chocolate, chili, and peppers include acid secretion and which can burst ulcer. Other herbs and seasoning are okay to use. Consume a balanced diet rich in fruit, vegetables, and fiber. So let's see the next erosions. Erosions in stomach. Erosions of small, shallow, superficial lesions pre-ulcer in the stomach. Protective muscular lining primarily caused by drugs such as aspirin and ibuprofen, alcohol, or H. pylori infection. They cause pain, nausea, or bleeding, wax stool, vomiting. Blood diagnosis include endoscopy. Treatment involves moving the cause and taking acid-reducing medicine. Definition: unlike deep ulcer, regions are shallow, superficial injury to the inner stomach lining. Muscular. Regular use of non-steroidal anti-inflammatory drugs is a major cause. Alcohol and tobacco infection such as Helicobacter pylori, H. pylori bacteria, stress, or philosophical stress in ICU. Burns or trauma can cause acute erosion. Symptoms include the following erosions. So let's see what the erosions really are. These are some of the examples of the erosion pre-ulcers, also known as pre-ulcers. 2:30 बजे
चाय पी ली?
पी रहा हूँ. Mallory virus tear. is a secretion in the mucous membrane at the junction of the esophagus and stomach, typically caused by forced vomiting, retching, or coughing. It commonly presents with vomiting, bright red blood, hernias, or black dairy stools, often associated with alcohol use or eating disorder. Most common heal symptoms within daily treatment, focusing on managing bleeding through endoscopy if needed. DS of Mallory vessel syndrome. The tear results from a sudden cause in an intra-abdominal pressure. It common cause of non-vascular upper gastrointestinal bleeding, roughly beside vomiting. Blood patient may experience abdominal pain, bloody or tar-like stool, and sometimes dizziness or fainting. While often linked to acute indigestion, the causes include intense itching, epileptic seizures, childbirth, or severe coughing. Diagnosis and treatment include through the EGD. Most tears involved without intervention, and but for persistent treatment include endoscopic, benign injection, electrocollocation, or clipping. Management include proton pump inhibitors are typically prescribed to reduce stomach acid, and in some rare cases surgical intervention may be required. Mallory vessel tears are the following caused by forced vomiting, retching, or coughing, commonly caused with bright red blood, hematemesis, or black dairy stools, often associated with alcohol or eating disorder. Common symptoms. Common cases heal spontaneously within a few days, with treatment focusing on managing bleeding through endoscopy if needed. Pathogenesis. The tear result from a sudden increase in intra-abdominal pressure. It common cause of non-vascular upper gastrointestinal bleeding. Symptoms beside vomiting, patient may experience abdominal pain, blood or tar-like stool, and sometimes dizziness or fainting. During chlorine injection, other include intense retching. Diagnosis and treatment through endoscopy if needed. Is a tear of the tissue of lower esophagus. It is often caused by violent coughing or vomiting. A Mallory vessel tear can be diagnosed and treated through endoscopy. If tear is not treated, it can lead to anemia, fatigue, shortness of breath, and even shock. Let's see if I can read some other article. Stools with blood present, weakness, dizziness, and faintness, shortness of breath, diarrhea, paleness, abdominal or chest pain, black tar-like stool, vomiting that is bright red and with coffee grounds. Mallory diagnosed, Mallory treated, will stop bleeding and begin to heal on its own. In most cases, sometimes you will need treatment, and endoscope may be used to give an injection or heal treatment to stop the bleeding, or insert a clip that closes the tear and stops the bleeding. What are the complications of Mallory vessel tears? In rare cases, Mallory vessel tear leads to severe internal bleeding. You get a rapid pulse, a drop in blood pressure, problem producing urine, and shock. If bleeding goes untreated, it may result in anemia with fatigue and shortness of breath. Esophageal varices. Esophageal varices are abnormally dilated submucosal veins in the lower esophagus, usually caused by portal hypertension from severe liver cirrhosis. They often include until they are ruptured, result in life-threatening hemorrhage. Diagnosis is through endoscopy, and urgent treatment include medication, endoscopic venting, causes and risk factor. Portal hypertension is primarily causes increased blood pressure in the vein that carries blood to the liver crosses advanced liver scarring, often due to hepatitis, alcohol, or fatty liver disease, forces blood to back into the esophageal vessels, thrombosis of blood clot in the portal or subclinic vein, parasitic infection. Symptoms of bleeding include blood, tarry, bloody stools, lightness or dizziness. Symptoms of shock and severe cases. Treatment is through endoscopy pending medications. It is an example of the esophageal varices is an enlarged vessel in the esophagus, often caused by severe liver disease that lead to high blood pressure in the portal vessels, hypertension. Tumors are the types of the cancer. Vascular lesions. Let's see what the vascular lesions really are. Vascular lesions. Let's see the example. First, see vascular lesions. These are some of the examples of vascular lesions. Congenital present at birth or acquired abnormality composed of clustered dilated blood vessels found or beneath the skin, ranging from hardness to serous. They include hemogyomas and vascular malformation. Structural defect. Common types include Weinstein, spider anomalies, and venous malformation. Types of vascular lesions. Symptoms include skin discoloration, physical changes, raised lumps or swelling, associated symptoms, pain, bleeding, or lubrication. Muscle, skin, or internal organ. Muscle, skin can be present in skin, muscle, or internal organ. So that's all for today. Let's pray for the best cause of their end life. Rabbana atina fid dunya hasanatan wa fil akhirati hasanatan wa qina azaban nar. Khuda Hafiz. That's all for today. We will continue inshallah in the next lecture. So how guys, how are you? We are continuing with the Kulsum Mamna Intensive Care Sciences, and today in the general surgery we will discuss the gastroesophageal reflux disease and the complications of the surgical procedure of the gastrointestinal tract and the diseases, infections, the problems associated with it. So upper GI bleeding, C3, P1, ulcer. So let's discuss what the ulcers are.